Well, good evening and welcome to Jen Cares, powered by Chosen Counselors. I am your host, Jen Cares, and the founder of Chosen Counselors, a nonprofit organization that seeks to inspire, motivate, empower, and strengthen individuals and families. Thank you all so much for tuning in. I thank you for tuning in, liking, sharing, commenting, watching again, all that jazz. Thank you so very, very much. So last week was really good. We talked about pets, and if you don't have a pet, or you do have a pet, check it out. I have to order Queen Cleo a water fountain now, but I'm hoping that anybody that did watch was able to learn something new. Again, you may not have a pet, may not ever get one. I don't know. But over here at Jen Cares, we're trying to cover all lanes to meet all needs of the community. So tonight, your health matters. Let me tell myself. So I remember when I was going through the process of purchasing my home, and I was supposed to be going to the doctor, but I didn't go. And it's because I felt like I would be stressed, overwhelmed, and if I go, they'll tell me news that I don't want to hear. That's how I felt. However, because that process of purchasing a home is really overwhelming. It's stressful. One day you're up, one day you're down. It's a lot. But once the process was over, I made my appointment. I explained to my doctor why I didn't want to come. And she said, I understand, but it's still good to come and get checked even in those moments. I'm doing better. So we've had a episode where we talked about the benefits that we get from our job. So that medical coverage, that vision coverage, that dental coverage. And sometimes we need to see a specialist because we want to be able to invest in ourselves. Talking about investing in ourselves, do y'all know we got a day of empowerment coming up on Saturday, May 15th. I have a ticket available tonight, so be sure to listen out for the key phrase that Dr. Charles will drop. So, we're going to talk about that. Invest in yourself, okay? So, another reason that I wanted to bring this topic to us, Your Health Matters, is because we enjoy Google, WebMD, and home remedies. And I just want to encourage us to find a balance, even in seeking out those sources, that sometimes we need to seek the professionals to get that real medical attention by somebody that really knows what's going on. Because WebMD and Google only can stay in one lane. A doctor, they can put pieces together that you didn't even think was supposed to go together and find out what's really going on for you. I was listening to somebody at a church service share a little while ago how God blocked something before it got worse. Essentially, his mom had got diagnosed with COVID and double pneumonia, but from her going to the doctor, she was also able to find out about another health ailment that was going on. Had she not went because she started feeling the effects of those other conditions, she wouldn't have known about the other thing. So sometimes we go for one thing and find out we got other things going on. And I know that could be overwhelming. I know that could be frustrating, but guess what? Your health matters. Your life matters. And tonight we're going to talk about it. So I tuned in to hear Dr. Farmer a little while ago. He was talking about COVID on a podcast, The Kickback with Joe B. Hurd. Y'all check him out. He has a good podcast. I love it. He's on Instagram. Check him out. So Dr. Farmer is educating the community about COVID. And I was like, Joe, how can I get him? Please tell me information. And I got into the DMs to say, hey, you want to come talk to me? What can you talk about? And he gave me a couple of ideas. So we're going to have him back with his wife, Dr. Dolores. But tonight, I wanted him to talk about our health and how it matters. I want us to talk about some men's health and how it matters. And just, again, all of that, of what we need to know that it does matter. So I'm grateful to him being able to join us on tonight. I harassed him a little bit just to make sure things would go well. And again, I am truly, truly grateful for his patience, for his willingness to come on. So help me introduce and welcome Dr. Charles Farmer, who's going to share with us about Your Health Matters.
Woo! Hello. Thank you so much for having me. And oh my God, I was just so blown away by your introductions. Just the intro and the flashing here. And I was like, oh my God, this is great.
We'll fashion you a little bit over here.
Yeah.
But thank you so much.
Yeah.
Okay, so how are you doing though?
I'm doing all right. I'm doing all right. As long as I'm here, I'm able to go to work, do my thing, be here for my family. I'm happy.
Good to hear. Okay, so over here at Jen Cares, we start with the quote of the day. And today's quote of the day is, take care of your body. It's the only place you have to live. Again, take care of your body. It's the only place you have to live. Dr. Charles, what's your thoughts on that quote?
I think that's a good quote, because, you really only get one life to live, right? So I think I think it stresses the importance of, making each day count and
Hmm.
doing what we can to stay here, as long as possible. And that means taking care of not only just our physical health, but also our mental health as well. So I think that quote, kind of hits the nail on the head for what we need to do, be doing.
I love it. And I love that you threw out there mental health because I am all about normalizing mental health because it is so very, very important as well as our medical health as well. Health as well. So, chosen friends, as always, I have prepared some questions to guide tonight's topic. But if you have any questions or any comments, be sure to comment below because Dr. Charles, again, we have an expert here. Medical is not my field. I'm not about that life, needles. Mm-mm. But Dr. Farmer, he does that. That's what he went to school for. So if you have any questions, type them down below. So, Dr. Charles, tell us a little bit about yourself.
Sure. So I am a emergency medicine physician. So
Mhm.
that basically means that I take care of patients that come through the emergency department. And so, as you probably could imagine, or if you've seen maybe even on TV, or fortunately if you had the experience, we'd see any and everything that comes through the door, through something as simple as I stubbed my toe, through even gunshot wounds, stab wounds, heart attacks, strokes, all the things you could possibly imagine.
Mhm.
And I work in a community where I work in I work in a community where I see a lot of underserved patients. So it's mostly minority patients, people who are immigrants, that speak a variety of different languages. And that's kind of the community that I enjoy working with. And for me, I guess, to give you guys a little bit of information on my educational background. So I received my bachelor's in biology from Seton Hall University. From there, I went to medical school at Johns Hopkins. And then I completed my residency training. So that's when you actually learn how to become an emergency medicine doctor. So I
Okay.
completed that at NYU. And I completed that in June of 2020. What a great way to end my training.
Yes. What a way.
But yeah, so now I'm in my first year as an attending physician. That basically means you're the supervisor of
Mhm.
the emergency department.
Very nice. Yes, I have watched Grey's Anatomy.
That's my
I
show too.
Okay, okay.
Yes.
So in my head, I watched The Resident as well. Do you watch The Resident?
I've caught a couple episodes. Yeah, I've caught a couple episodes of The Resident, The Good Doctor. I've watched a couple episodes as
Okay.
well, and all of them are like really good shows.
Are they really close to what y'all really do?
What's funny? I get that a lot, and the one that I've heard is the most, which I haven't watched it. I've heard Scrubs is the closest.
Okay.
But I mean, I will say I feel like there definitely are elements of like Grey's Anatomy, and I probably say House because I do like House because it's funny.
Okay.
But there definitely are some elements that can be found, especially during residency training, for sure.
Awesome. Awesome. Yes, I
Yeah,
love Scrubs. I love Scrubs as well.
yeah.
So that's really good. So, why did you work to become a doctor? Was that what you always wanted to do?
Yeah, so I think I really got into the thought of becoming a doctor probably around like the eighth grade, which
Mhm.
is sometimes some people just kind of know it's their calling. A lot of people don't really develop that thought until later on in life. But for
Mhm.
me, I always enjoyed science because I was always a kid that like loved to see like how things worked, and I thought it was so interesting that like there's so many things out there we still don't even know. We're still trying to learn.
Right.
And I wanted to have a career where not only I was going to be invested in science, but also I was going to have the opportunity to use that knowledge to help people. And, being a physician really allows you to combine both of those things. And, I think one of the things that really solidified it to me, because like I always wanted to, and I think everyone kind of has this thought process when looking for a job is that like you want a job that like challenges you, that gives you something exciting to do like every
Right.
single day. And for me, especially with emergency medicine, like
Absolutely.
I never have the same day over like there's never a boring day at
I
work.
believe.
So I think that's kind of what drove me to become a physician.
Awesome. So thank you again, because that's not my speed. My sister, she works at the Red Cross, so she's giving people
Oh,
needles all day. I can't
oh
do
yeah.
that either. I'm gonna stay in my lane. Um, so with the emergency room, it's amazing that there's something new every day. Did you always want to work in an emergency room? Did you have like a choice of where you wanted to be stationed at?
Yeah, so that's a good question. So throughout medical school, when I initially came in, I was interested in emergency medicine, and part of that was because I had a really good opportunity when I was an undergrad to actually shadow an ER doctor. And once I shadowed him for like a couple of hours, like I was totally sold. But I still tried to go in with an open mind. And during your training in medical school, you go through different like rotations in different specialties. So like you rotate in like pediatrics, internal medicine, and things like that. So I was a little interested in internal medicine. I like some things about pediatrics, but the beauty of emergency medicine is you really get to combine like pretty much like everything of all the other specialties, right?
Mhm.
So like I get to do like procedures. So if you like procedures and you're interested in like surgery, I kind of get to do a little bit of that at work. I do a little things with I do see a lot of women that come in with like GYN complaints. So if that's something you're interested in, then I do a little bit of that. I see kids as well as adults. I get a little bit of pediatrics. So I kind of get a little bit of everything.
Okay, so with the ER question, who do you see the most of, males or females?
Ooh, that's a good question. Oh, I don't know. If I would guess, I probably would say females because just in general, men don't really like coming to the doctor.
What?
So I guess I probably would say females if I had to say, yeah.
Okay, so that's what I was trying to get at. So I want to see if males are really coming. And the emergency room is where something's really going on. So I really need to be clean today.
Right.
Okay. So females are going, but the males aren't. Okay, we got to work on that, brothers.
Yeah.
So with emergency room being like, hey, this is where I want to be, what was like your second choice?
Ooh, I probably would say it was probably a tie between pediatrics and internal medicine. So when I say internal medicine, for those who may not be familiar with the term, it's basically they're basically your primary care doctor, right? So the regular doctor that you or that maybe your parents see, that's what they call an internist. So I was probably between those two.
Okay. Yes. Yeah. I didn't know. Thank you for educating me on internal doctor. I definitely gave my doctor a whole full interview without her knowing it before I selected her to be my doctor. I just wanted to know that she was capable of really handling somebody like me that didn't know nothing.
Yeah.
That's important.
Yeah. I think it's important because you should be comfortable with your physician. And even myself and my wife, we do the same thing with like choosing our physicians as well. Mm-hmm. Like I'll ask other colleagues like, hey, did you hear about this person? Like, what do you think about that person? So no, I don't fault you for that.
So another question, since you are a doctor, when you go to the doctor, do you hold them at a different standard? Are you like watching them tit for tat to see if they're doing what they should be doing? Or do they treat you any different?
You know what's funny is that like I actually try to make a conscious effort not to tell them that I'm a doctor because I just want to see how I'm treated. Mm-hmm. But as we kind of become more comfortable and like especially when they're kind of explaining things to me, I can say I kind of get that. I will eventually tell them. But for the most part, I really don't tell them in the beginning. But it definitely is a change for sure when you acknowledge yourself as a physician. And we actually, when I was in maybe it was my first week or so of being a resident as an intern, they actually did this exercise, which I thought was actually profound. So what they did was we pretended to be patients and actually like went into the emergency department. So like no one, only a handful of people knew because they wanted us to realize what it was like to be a patient, because they said from now basically till forever, you will always be treated as a VIP when you get medical care. And it was interesting to see how, especially being like an emergency department, just like how it feels to be like so vulnerable, like to be in like a crowded area with like everyone listening to your patient information and stuff like that. And, you sitting there wondering like, are they believing me? Like, are they taking what I'm saying seriously? So, but there definitely is a change for sure once you do acknowledge yourself as a physician.
Oh, I like that they had y'all go in as patients. Yeah. What did you learn from that experience other than just hearing things like, does it change now what you do?
Definitely it makes me a little more conscientious of like what I'm saying with the patient and realizing who may be around, because, especially in the emergency department, we do address a lot of like, private things. Like, we deal with people who, have HIV, and that's a very sensitive thing. We deal with patients, who are transgender. And, that's definitely, a group of people that we need to do a better job of making feel comfortable, because, quite sometimes they're not really as open to being able to, explain things. And we need to know some of those things, right? So it makes me, a lot more conscientious about like, the things that I say, and also being aware of like who's around me.
I love it. I like
Yeah.
it because it's showing that you're always learning, and we all
Yeah.
are always learning how to
Right.
build support so all populations. Pretty cool.
Yeah.
So, because men don't come as often, what are some of the top concerns that men should be aware of as it relates to their health?
Oh boy, quite a few. Well, quite a few things, right? So, probably one of the most important things is, and this is not even just for men, this is for women in general, is
Oh,
cardiovascular disease.
uh-huh.
And like 1 in 3 people are usually affected by that. And when I say cardiovascular disease, so that's anything that really affects like your heart or like your blood vessels, and that could be anything from like high blood pressure, stroke, heart attack, and it's like one of the main causes of like death. So that's some. And the thing about it is, there's things that you can do in your life that can help prevent that, right? So it's actually preventable, if there's certain steps that are taken. But it's definitely something that you have to consistently see your doctor about and manage. Probably the other things that do come up, certainly like lung disease, especially if you're a smoker. And then I guess in terms of the cancers, I feel like that's what a lot of people have questions on in terms of like health screening and such. So prostate cancer and colon cancer, probably the ones I hear the most about. And I think we're going to get into a little bit about the screening issues, but are things that you should look for. But I'd probably say those are kind of like the main things that I see affect men. And then just as a nature of like the area that I work in is definitely drug use as well, especially opioids. That's definitely something to see. Again, not something that not saying that women don't have it either, because I see them all as well, but definitely with men dealing with drug use.
Okay.
Yeah.
Well, the flip side is the females and then the women. What are some of the top challenges with some of those that you've already mentioned that the men and females go through?
Yeah, I mean, along with a lot of the same things. I mean, definitely cardiovascular disease as well. With women, at least in regards to like the cancers, you definitely have to get or talk to your primary care doctor about screening for breast cancer, screening for like cervical cancer, which probably more like your GYN. But those are kind of like, I'd say like the main things that I think should be addressed when you're talking to your primary care doctor or gynecologist.
Got it. So I see some memes sometimes, and they're saying that men die before women. Is that
Right.
true?
Well, what's funny? Because I when I heard this question, I was looking up. There's like so many different reasons why this is happening, right? So it's a bunch of different factors. I think some of the main factors that I found is, number one, men participating in a lot of riskier behaviors, compared to women. So like being involved in like violent situations, being involved in, jobs that are, high risk, especially construction type jobs. I can't even tell you how many like injuries I see from like construction workers like on a daily basis. Like a lot of them are like using like fingers and hands. It's insane. But yeah, so a lot of that, definitely, like I said, I mentioned like with drug abuse and like alcohol use as well, because definitely, developing alcohol disorder puts you at risk for a whole bunch of different things too. And then also, like we said, like, and not even just the physical health, but even just the mental health as well, because men, although women are more likely to actually like attempt suicide, men are more likely to actually complete suicide. And also with men is that like I mentioned before, not even talking about going to see a primary care doctor, is that you don't really see a lot of men, especially in the African American community, address their mental health or seek care when they really need to. So I think all of those things, certainly lead to men dying at a younger age compared to women.
Got it. All right. Good to hear. Good to hear. So women, keep on not doing too much of that risky stuff, and you'll live a little longer.
Exactly.
But still get your health checked, because something else could be going on.
Right. Exactly.
So with that, why question for like the construction workers that's coming in, a thought that came to mind is maybe some people don't come to the emergency room or a doctor because they don't have insurance. Are there programs within hospitals to help them out to be able to be seen whether or not they have insurance or not?
Absolutely. So that's a good question that you asked. So there are laws in place that any patient that comes to the emergency department, the law is called EMTALA, but any patient that comes to the emergency department is entitled to a health screening by a physician, no matter your ability to pay or not. And also, if you have like something that's life-threatening or dangerous, again, we have to treat you no matter what your, insurance status, immigrant status, it doesn't matter.
Okay.
But that being said, yes, there definitely are, like I see a bunch of patients who don't have insurance, and that's certainly a concern that they bring up. But like you mentioned, there definitely are programs, at least at our hospital, we have like charity care that helps like with assisting people with their medical bills. But, money should never be, a reason for you to not, get checked out or get seen by, a provider. Because the last thing, especially for things that, are preventable, because the last thing you want to do is to put things off and put things off and put things off. And then now it's actually like a dangerous thing. And now you're coming to see me in the emergency department, which I prefer you not do, so, but the best thing you could do, is like look into those types of programs and, try to establish care with a primary care doctor so that you can prevent, finding a bigger issue.
Got it. Understand. Yeah, definitely. The programs, because even those that have health insurance, sometimes services are outside of what your insurance is, so their payment plans and things. Actually came across an article not too long ago that also stated how you can get things reduced or a cheaper version of things that come on your hospital bill. Look into your options is all I'm saying.
Yeah, exactly. And, have conversations with your physician about your financial concerns as well. We also have, and I give this out, we also have prescription cards that take off like 80% the medications cost. So if we prescribe someone like antibiotics, they can take 80% off of it. And where I used to work at in Bellevue Hospital in New York City, which is a public hospital, the pharmacy that we had there, if you didn't have insurance, you could actually pick up your medication for free. So there are ways, that you can still get treated even if you don't have insurance.
Very nice. Good to know. Good to know. We learned it today, chosen friends. So in the veins of that, you say it's good to go to a doctor so that you don't have to necessarily go to the emergency room as your first resort and things of that sort. So why do I need a primary doctor?
Good question. So you need a primary care doctor for a couple of reasons. Number one, you want to have someone that you can establish like a relationship with, right? Someone that you feel comfortable with, someone that you can communicate, any problems or any concerns that you have. Because I think, and just kind of going back to talk a little about emergency department, is that I think sometimes people like the ease of the emergency department, right? Because, you can come in and, you get seen. I mean, you might wait a couple hours, but you're going to get seen by somebody, as opposed to a primary care doctor. I think the biggest concern is that, okay, I got to make an appointment and I might not be able to get an appointment for like a couple weeks and stuff. But, again, there is a benefit because they're the ones that are going to help manage, any chronic issues that you may have. And then also do screening to be able to catch, certain issues as well. So that's why it's really important to have, a primary care doctor, someone that you can go to on a consistent basis. Because I'll give you an example. Probably one of the common things I will see someone come into the emergency department with is my blood pressure is high, right? And in all honesty, most of those patients really don't have any symptoms. Like their blood pressure is high, but they otherwise feeling fine, right? And they want or expect you to give them a medication that's going to suddenly drop their blood pressure. Now, that's actually not really a good thing. Dropping your blood pressure really fast is actually not good for your body. And also, any medication I give you is not going to really last that long anyway, because your blood pressure should be kind of brought down like in a gradual kind of state, not really like a super fast one. But that being said, that's why it's important to have a primary care doctor, because someone who's going to follow you, someone who's going to say, hey, I want you to be on this medication and I want you to come back to me in 2 weeks and check, I'm going to check your blood pressure again and make sure it's good. Someone who's going to continuously try to follow you and make adjustments as needed.
I love that. It made me think of a barber. So I go and get my hair cut. And the guy that I go to, I could sit in the chair. He knows what to do. I don't have to ask any questions.
Right.
I went to another person because he wasn't at the shop that day. I had to ask so many questions. I don't know those things. I didn't know the terminologies. And I was getting frustrated. But I needed my haircut, But that's the same thing with a doctor. When you have that doctor that knows you, you can sit in the chair, they know everything. You don't have to repeat things because they remember. Well, they have you in the files where they can see and things like that. But you go to somebody new, it's like you starting all over again. You say, you want me to cut what? Do what? Design what? And it can be frustrating. So that's like a good analogy of why it's good to have that one consistent person.
I like that. I'm going to steal that from you. I love that analogy about the barber. Because every black man knows they have the barber that they go to, and that someone else will mess up their hairline. So
Somebody
I
else will
like
mess
it.
with their hairline. So you want to
Yes.
go to that person that you know is good. So another thing with that, is there a difference between is there a difference with primary doctors? So I know that I'm thinking the answer is yes. So they have like specialized doctors and things like that sort, or can my primary doctor do everything top to bottom?
Yeah, so that's a good question. So your primary care doctor is in most cases either going to be an internal medicine doctor, so someone that did their training in internal medicine,
Mm-hmm.
or family medicine.
Okay.
So family medicine training is slightly different. Like they can see like pretty much like any ages. Like they'll see like from birth to like you're old.
Mm-hmm.
And then you may have some
You're old.
internal medicine doctors who specialize in dealing with like the older populations, like they're geriatric doctors. But if you're talking about like further specialists, like let's say you need a heart doctor, like a cardiologist, or you need like a GI doctor. So they are trained in internal medicine, but they took it a step further and did some further additional training in their particular field. And that's why they're able to be cardiologists and like GI doctors. So it's a little bit of a difference.
Okay.
Yeah.
So it's a little difference.
Yeah.
You talked about how there's some things that we could do to help us stay on the right path when it comes to health concerns with like the blood pressure. What are some of those things that we could do?
So I mean, there's a couple things that you can do, I think, that are good overall for your health, right? So obviously going to see your doctor regularly. I think we don't really emphasize the importance of getting sleep. And I think with just everyone's like super busy schedules between social media and all these things, is that we don't really take into account how much sleep actually, is important. And I think also, and I think I know I was guilty of it in college, is that like we kind of bank on the fact that like, we might have horrible sleeping habits during the week, and then we think that we'll just sleep in on the weekends and then we'll be good to go. And that's not really the case. Like it actually takes like several days to like get back to like a normal like sleeping pattern. So I think trying to get a good night's sleep is important. I think eating healthy as possible and being aware of what we put into our bodies. I think also getting daily exercise, or at least as much as you can. Even something as simple as like taking a walk around the block, I think can do wonders for your body. And then I think realizing the importance of like your mental health as well. I think we're all guilty of between our jobs, between spending time with friends and family, and all these stressors and stuff that come with just life in general, is that I think it's hard to sometimes just take time for ourselves. And I think it's important that you identify at least something that at least gives us a little bit of break and gives us like some peace of mind, and also seeking help when you need it too.
Oh, good things. I gotta figure out what that sleep one is. Sometimes I don't know.
Yeah.
And we all fall victim to it. Either we're not eating right one day, we're not getting out to get some of that vitamin D and things of that sort. I was like, I'm gonna go walking. Then it was like storming. Not today. But it's things we can do in the house to keep ourselves moving and things of that sort. Might have been going the steps a couple of times. I don't know.
Exactly.
But it's those little things that do add up to do something to help you to stay active and seeking help when it is needed.
So I'll give you a tip with the sleep, because my uncle, he's a family medicine doctor, but he actually specializes in like sleep.
Oh, it's all in the family.
Yeah. So he actually wrote a book about sleep, and so one of the things that he always says it to me too, is that like number one is to try to go to bed when you're actually like tired. So when you start like yawning, like that's kind of your body saying like it's time to take it down. And a lot of people try to fight that, right? And then the other thing he said is, and I read it other places too, is that like try to limit how much light is around you, at least about an hour or so before you go to sleep. So that means shutting the phone off, no Instagram or anything like that. Shut the TV off. You can like have a little bit of like dim light if you like choose to read or something like that. But because the thing about it is that like when we're on our phones and stuff, the light is telling our brain like, wake up, we need to stay up right now. and then when you're ready to go to sleep, the brain's like, whoa, why are we going to sleep? I thought we need to be up right now.
Yeah. That's funny. I have actually found the the thing to sabotage that, where I dim my light on my phone.
Yeah.
I dim my light on things so that it looks like it is dim, it is quiet, but I'm still paying attention to what's going on. Still
Okay.
not good. You got to figure out
Yeah.
things.
Yeah.
And then when I was really struggling one time, I put on like some sleep music or things of that sort, a nighttime story, because it's so nice and
Yeah.
soothing. Tell me, because like Jennifer, you're going to find something else to do. Put something on, shut down. You got to shut down.
Yes.
That's good to know. All right. So I need to turn stuff off. I'm going to do that today because I feel like I'm tired. So we talked about the healthier path. So with family history, so grandmama and daddy and them had X, Y, and Z. What's the importance of family history? If they had it, why should I know?
I mean, family history is very important because, so many different medical conditions, have shown some evidence of being like hereditary. And especially, when we talk about like the different screening tests that can be done, like, for example, for like breast cancer, for like prostate cancer, for colorectal cancer, the age where you may be recommended to be screened may be different if you have a family history. If you have a family history, you may be recommended to get it actually earlier than someone who doesn't have it in their family. So all of that is actually like, really important. And then also even for like, various cardiovascular issues, right? So if you have a family history of like someone dying from like a heart attack in their like 30s or 40s, like that's something that you should be aware of, and your primary care doctor should be aware of, because that maybe you may also have it in your heart too. So yeah, family history is very important.
Got it. So sometimes I'm because it's in the history, I may need to get tested prior to when that person was diagnosed with it and things of that sort.
Exactly.
Okay. What, and I guess based on what the history is, lets me know what exams I should explore.
Exactly. Yes.
Okay. Got it. So when speaking of special tests, we talked about, I shared about in the intro about how WebMD and Google can really help diagnose ourselves. What is it good to look at WebMD and Google?
It's funny. Like when I first started out as like a physician, oh my God, it used to frustrate me so much. But I feel like I got as I progressed through my training, and even now, like I appreciate that people do take the time to like look at their symptoms, because I think it shows that they're taking control of their own health and they want to genuinely know like what's wrong with them. So I do encourage that if you are concerned or you're sick or something like that, that like, I think it's okay to look, but write down what your questions or concerns are, and then bring it to a physician and have the physician kind of explain why. Yes, you know what, maybe this is something that we should do, or nah, I don't think you really have this. So I think it's important, definitely to look up some information. I don't think you should let it, freak you out too much, but just write down your questions and then bring it to a provider.
So I'm hoping that one of my friends is not watching this, because I have a friend that really goes on there and diagnoses herself and say, I'm not the dog.
Right.
So he definitely gave boundaries with that. That's not the end all be all. It's good to find out. So you can be in the same vein, but it doesn't mean that is what it is spot on.
Exactly. Because they'll put like some of the most rare things that like I've never even seen before. So, I get it. It makes sense, but try to write down your questions and get that answered first.
Got it. So when I am going to the doctor and when I am going to the specialist, I want us to highlight the importance of what should I be asking? So like, you're going to give me some results when I go, even to the emergency room. You're going to tell me, bam, these are the next things I have to do. You're going to tell me I need to follow my primary doctor. What other questions should I ask during that time?
So if you're just going to a regular doctor, you're going to the ER or just
ER, regular doctor. Should I ask questions? Is my question.
Absolutely. You should ask questions. I would say to make sure you understand if they have reached a diagnosis, make sure you are able to understand what the diagnosis actually is. I would say, if for whatever reason, because especially even in the ER, we don't always get to the answer, but make sure you have an understanding of what they have ruled out. So that's something that you can go back and tell your doctor, or you should understand, like, okay, I came in with chest pain, right? They checked me to make sure I didn't have a heart attack. They said I didn't have it. Okay, cool. They did an x-ray and made sure I didn't have pneumonia. Okay, I don't have pneumonia. Cool. So and ask like them to kind of break down like some of the tests and imaging and such, because you really should have a good understanding of like your own healthcare and what's being done to you. And I'll give you a quick story. When I was in med school, I did a rotation with this surgeon. He was like very, very well known surgeon at like Hopkins. Like I think he invented some procedure. But I was in clinic with him one day, and he told me that like, so every patient that came in, he would ask them, "What surgery did I do on you? What surgery did I do on you?" And some of them got it, some of them didn't. He said, "The reason I ask you this is because one day I'm not going to be here, and you should be able to explain exactly what procedures were done to you, so that if you're in the middle of the woods, something like that can happen, like you should be able to explain it." So I definitely encourage everyone, write down your questions and make sure that you understand it. And even if we explain it one time and you don't get it, ask us again. Ask us to break it down like another way. Like you shouldn't never leave a physician's care and not have a clue like what's going on with your healthcare.
I love it. Also, slight joke, because when doctors write, their penmanship is some doctor's penmanship is a little different. So don't have them write it down. Really have them verbally say it so you understand what you're saying, because you're not going to understand. Back in the day, we had prescriptions. We take a little slip of paper to the doctor, pharmacy, and I don't know how the pharmacist always understood. God bless them. But again, ask those questions to know for sure what is going on. You have that time while you're with that professional that can really break it down. Even as Dr. Charles has been sharing, he's like, and this means blah, 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 blah. Thanks, because I don't know. That's your field, So when you know it, you'll use the terms, but making sure that, I don't want to say dummy it down, but really making it where even a child will understand what it is that's going on.
It's funny you mentioned the handwriting, because growing up, my handwriting was terrible. And I can't even tell you how embarrassing it is, because my mom is a teacher, right? So her handwriting is amazing. So it's funny, like when she would come to parent-teacher conferences and like sign her name, like the teacher would be like, "Oh my God, like, are you guys related? Like his handwriting is so bad. Like what is going on? Like I don't understand what happened."
Oh, wow. Yeah. See, don't have them write it down. You just have to verbally tell you.
That's why we moved to electronic prescriptions. So we don't have to do that.
And even when you're leaving the doctor, they have it where you can get it a printout, especially at the hospital for children and things. So they print out everything that happened. So you get a little question and answer in there as well. So fully let you know what's going on.
Right.
So we have a question from a chosen friend. Lisa said, how important is it in obtaining a second opinion?
I think it's very important. I think that, I think with anything and I often I feel like I've had experience with patients like seeking a second opinion, especially when it comes to like either cancers or any other type of medical condition. I think it is totally appropriate to get a second opinion. I don't think anyone should feel any type of way or any type of shame or anything like that, but seeking another medical professional advice, because at the end of the day, and we're all human, like we all make mistakes. We're not all perfect. Somebody may have a different perspective of a disease than another doctor. So I definitely encourage anyone to get a second opinion.
Got it. Very important. I had a friend, she went to the emergency room to get support. They told her to go to her primary doctor. Her primary doctor and told her to go to the emergency room. We don't like to back and forth so much. I get it, I guess, because they want you to go see your primary doctor. But if your primary doctor is already aware of what's going on for you and knows that you may go to the emergency room or encourage you to go to the emergency room, what's the process for that? Kind of just have an emergency room call your doctor?
Yeah, so that's a good point. I think that's also where, we, kind of struggle a little bit, is that like, I think it falls, especially on the primary care doctor too, if they know exactly what emergency department they're going to, and let's say if they don't make it clear enough for the patient, or the patient doesn't really understand, I think that's when communication is very important. And so I have patients come in with like a note from the provider saying, I sent them in because X, Y, Z. And that's like so helpful to us. Or even just calling us on the phone and say, hey, I'm sending so-and-so in because I'm concerned they're having like a heart attack. Like, that's great. That gives us something to work on. So I definitely encourage that, if, for whatever reason, hopefully not, but if you ever, have an experience with your primary care doctor or urgent care doctor or anything, and they're sending you, ask if they can call ahead, or if they can send you with some type of documentation explaining why you're going there.
Very good. Very good.
Yeah.
So let's talk about going to the doctor. So recently, vaccines and shots is really, really popular right now. So let's talk about the flu shot, because that's been around a little longer.
It has,
Do I have to get the flu shot?
Well, I mean, you don't have to get it.
You're absolutely right. You're absolutely right.
Right,
What are
right.
some benefits or drawbacks of getting a flu shot, maybe?
Gotcha. I mean, overall, I would say benefits greatly outweigh any type of risk from like the flu vaccine.
Mhm.
And and we've seen that from various studies and just watching it like over the years that it does a good job of reducing the amount of people that not only get the flu, but also reducing like its spreading as well. And the
Mhm.
biggest thing with a lot of these vaccines is while it's not 100% perfect, there really is no vaccine ever that is ever going to be 100% perfect,
Mhm.
but it reduces the amount of people who develop like severe disease from the flu and end up in the hospital, because
Okay.
ultimately that's like the big thing that is scary with the flu, with COVID, all these other like viruses that like
Mhm.
overwhelming the healthcare system. And we've had bad flu seasons. Even a couple of years ago, we had a bad flu, and it makes things difficult in the hospital when we're not just dealing with like the regular stuff that comes in, but now we're dealing with a whole bunch of people coming in from the flu,
Mhm.
and we're trying to get to see everybody. Inevitably, we're going to end up missing people. Like it's just a mess. So hopefully, with the flu vaccine, it does help reduce those numbers. And you can see it this year, because like this year was like the most people that got the flu vaccine. I didn't see a single case of flu all year. Now, part of that is, from the social distancing and stuff as well. But
Mhm.
like people like in record numbers got the flu vaccine this year. They're like, oh, that's that's the last thing I need to get right now. So, but it made a difference, right? So
Yes.
I would encourage anyone, especially if you have medical problems, or
Mhm.
you work in a career where like you're around a lot of people.
Mhm.
Um, I would definitely be it, and I'm an advocate for it.
That's funny. Record numbers for
Yeah,
the flu shot, because like I don't need that or whatever
yeah,
else is going on. That's funny.
yeah,
Um, so we're going to talk about COVID next week, but I want to hit this piece of an emergency room. So some people
yeah.
are fearful of going to the hospital, of going
Right.
to maybe even their doctor because of everything that's going on with COVID and things of that sort. What
Mm,
in the hospitals, I don't want to say that it's supposed to be the clean space, but I know they
yeah,
really do specialize in that, making sure it is clean because people come in, come out, and things of that sort. What are
yeah,
some things that can help ease some worries of those that do have some health things going on, but they're hesitant because it's like, I know it's going away or it's going down or maybe it's not
yeah.
really going, but I need to get this checked, but I don't want to go because I might get wrong.
Gotcha. Yeah, excellent question. Yeah, I'll give a shout out. God bless our facilities folks, at
Mhm.
the hospitals that have been working, because they've been, amazing with like, because we really couldn't function without them.
Right.
Um, and to answer your question, it's interesting because when the pandemic first started, and we kind of got hit with like this massive wave of like COVID, we were all sitting wondering like, where are the stroke patients, like the heart attacks and stuff like that. And I think a lot of people were afraid, and they were just kind of choosing to like get sick and die at home, which is extremely unfortunate.
Right.
Because we potentially could have done something. Um, but for that being said, I think that we have learned from that experience, and we've gotten a lot more comfortable with trying to keep all the patients safe, no
Mhm.
matter what you come to the emergency department with. So, obviously everyone is in masks. We do try to, as much as possible, try to keep, people separated. Especially in terms of primary care, that's the beauty of like doing the virtual visits that became like really popular. They were already kind of doing those initially, but now
Mhm.
even more so that became popular, especially if like you're just coming, you're doing it for like, maybe you need like a medication refill or anything. There's no need for you to come to the doctor just for that.
Mhm.
But there are a lot of different ways that you can communicate with your, doctor now comfortably.
Mhm.
And I think if you're ever concerned, I think you're well within your rights to give a phone call to the office. And even something that my mom does, which is great, is she's asked about like the COVID protocols, like what they had there. But what she'll do is like, she'll go and sign in, and then she'll just sit in her car, and say like, "Hey, give me a call when you're
Yeah.
ready to see me,
No,
and I will get out
that's
the
a
car."
good idea. Sign in and then wait in your
Exa-
car.
yeah,
Got it.
exactly. You got to do what you got to do. Especially for
Absolutely.
those people that have pretty serious problems and really can't afford to get sick. You got to do what you got to do.
I love it. I
Yeah,
also love that plug for the facilities and things of that sort. I'm always one to, greet those that are cleaning up because you never know
yeah,
when you need a trash bag or a box of
yeah,
tissues and things of that sort.
yeah,
Now they're positions are more what's the word? Essential, because they're helping to
Yeah.
keep things clean, keep things
Yeah.
sanitized, to help us to be able to do what it is that we're doing. Even in the stores, wherever you're going, there's somebody that's checking, there's somebody that's cleaning up the carts. I say thank you so much. It's not probably something they wanted to be doing, wiping down carts, but I appreciate it because it's their efforts of trying to make sure that things are safe for us.
Absolutely.
Really pretty cool. Shout out to all of those that do cleaning work, whether in a school, hospital, bank, the church, wherever you at. I saw the funeral, and as they were passing Mike, somebody would get up there like this.
Yeah.
I said, yo, y'all need to get that boy a raise. He up there getting it together.
Exactly.
Because so many people are transitioning things of that sort. So again, definitely thank you to all of those. So I joked with you before we started about Tyler Perry. I like Tyler Perry. Because he does some plays and productions where he's joking about something but also educating us. And it was a scene in the play Was Done in the Dark. No. Was Done in the Dark. I don't know what it's called. Maybe it is Was Done in the Dark. Nevertheless.
That sounds familiar, like a Tyler Perry title.
Yeah. All right, tread lightly. I like Mr. Perry. He might want to adopt me one day. But Mr. Brown is going to the emergency room actually because he's trying not to get on a plane to go on a trip. But what happens is, as he's seeing a doctor, they're talking to him about having his polyps checked and things of that sort. So he's thinking like the polyps is pollen with the allergies and things, or it's plaque with his teeth. Bless his heart, and I know. And then he wasn't. He's opening up his mouth to get his colon checked, not realizing it's the other end. It was a whole bunch going on. Mr. Brown is a whole fool.
Right.
But then it was a piece on my blood sugar with like too much sugar and Kool-Aid and things of that sort. What are again, I like it because they joked about it, but the importance of it. So what are some things with our colon that, what would cause us to need our colon to get checked? And is that for males only, or is that females and males?
Males and females. I would say, well, a couple of things, right? So like, definitely for colon cancer screening. And like I mentioned before, the main age is usually around 50, but again, that depends upon, your family history, right? Unfortunately, we had lost Chadwick Boseman earlier this year to colon cancer. He wasn't even that old, right? He really wasn't even, I don't know his family history, but he really wasn't even at the age to where they would have even started screening. So that's why family history is important, because they will start checking a little earlier. But then other reasons, I mean, to check your colon is, if you're having, any changes like in bowel habits, or like, it's like any blood or anything like that, like, those are all reasons, to talk to your doctor and probably get a GI follow-up. And then they end up, recommending like a colonoscopy, just to check and make sure that nothing else serious is going on. So, a variety of different reasons.
What's a GI?
So that's basically, so as I mentioned, so that's someone that trained in internal medicine, does some additional training and diseases that affect like the gastrointestinal tract. So that's like dealing with like your esophagus and like your stomach and your colon. And a lot of times they'll do procedures like an endoscopy. So that's like when they take like a camera and they basically go down to your esophagus, just to make sure like there's no like acid reflux, there's no inflammation in your stomach, or things like that. And a colonoscopy is pretty much the exact opposite. They just take the camera and then they just go from below. But that's a lot of what they do in the office.
Oh, I saw somebody sent me, I think it was a TikTok or something, where someone was getting they were having a swallow test done. So you see like the images of them chewing and going down, and somebody's like, I see where stuff gets stuck at all the time. I don't know if that happens, but it's interesting to see. But it's good that somebody can check to know what is going on, what the blockage and things is. A friend also had a colonoscopy done recently, and I went to go pick him up. And when I was picking him up, he had like the images and things. I said, that's a bit too much. I didn't want to see that much. But it's also good to see that you get to see what they saw, and then you can ask any questions related on it. I mean, I've had like x-rays done before. So like they give you a disc, like, hey, probably I got a CD. Probably not the one that everybody wants to buy, but it lets me know what is going on with myself. So that's good. And then with the blood sugar, what are some identifiers maybe that can let us know that maybe we should get that checked out? Because that's the diabetes. Is that on it?
So right, exactly. So diabetes, which is basically when your sugar levels are high and your body, for whatever reason, because like our bodies make insulin. That's the medication that like decreases the amount of sugar in our body. And depending on the type you have, basically there's something that's wrong that doesn't allow your sugar to lower as it should. Your sugar can get high.
Okay.
And a lot of people, their presenting symptoms will be they noticing that like they're more tired, they are more thirsty than usual. They're urinating a lot more. That's because like they're peeing all the sugar out of their body. And so that's definitely, you know, a red flag to go to your primary care doctor, or if you're really, really sick, to go to the emergency department to get your sugar levels checked. And usually as you get older, especially if you have a family, a history of it, you know, your doctor may check your sugar. Usually what they may end up doing is they may have you like fast for like a day and then check your sugar. And then there's also some blood tests that they can also check as well.
Okay.
Yeah.
So a couple questions to find out when I should see a doctor about. Should I see a doctor about heartburn?
I think, yeah, if you are having any type of concerns at all, especially if you're having like any type of like pain in your chest, like I think that's certainly appropriate to see your primary care doctor if you're really concerned, especially with pain in your chest, because I mean that could be a whole bunch of like potentially dangerous things. I think going to the emergency department is totally appropriate for that as well.
Okay.
Yeah.
And again, knowing like so like if you have, for me, if I have tomato, something with like that kind of too late. Or I have it and whatever reason it just sneaks up on me. Some days it just really gets me. Again, I do my little home remedies. I'm not gonna hold you. Some pickle juice. Some apple cider vinegar, because it knocks it out. You don't have to take a pill per se, but that'll help with that acid and things of that sort. But knowing that if it's happening an overextended amount of time, then definitely that's something of alarm. Because if it just happened at one time, grapes gave me heartburn one time. I said, this is disrespectful. So really identifying what it is that you ate that could have caused that thing to be off balance. But hopefully not. So because does this happen where like it happened one time and they come to the emergency room and then it's not really much you can do? How does that work?
Yeah, literally like a lot of the time I'll say that like that people will come in with either like some type of mild condition or it's something that we just, you know, we rule out a lot of dangers. That's what our job is, really, to rule out the dangerous, life-threatening things, right? And sometimes we don't always get to the answer. So how I always phrase it is say, you know what, I'm glad you came in. You know, I definitely could appreciate this something concerning. Here's what we did for you today. We ruled out that you didn't have a heart attack. Ruled out you didn't have this. Ruled out you didn't have that. I'm not exactly sure, you know, what the cause of it is, but I don't think it's anything dangerous. You know, I would like you to follow with your primary care doctor. But if for whatever reason you start to feel worse or you feel even more concerned, then feel free to come back.
So I'm writing this down. If I go to the doctor and they say, so I'm glad you came in, I'm like, y'all trying to kick me out? I'm really dying. It's like the end of the movie is coming. It's like the and it's about to be over. It's like, but wait, no. Wait a minute.
Yeah. Right. Because I think we, you know, as we also want to be sensitive because, like, you know, people come to the ER, you know, all the time because they're scared, right? Because they're concerned about something. And I feel like, you know, we need to, you know, respect that and make, you know, not many people feel bad for coming to the ER. Like, I'd rather you come and we make sure it's nothing as opposed to you just sit at home and just die. Like, you know, like no one wants to see that. So,
right. Because everybody don't have those little things. So I'm 21 plus but they used to say the little things where you say, help, I've fallen and I can't get up. And then somebody could come out to you. Everybody doesn't have that. So then sometimes you're just there. So it's best to go when you can go.
Exactly.
So with like a sore throat or fever, back pain, joint pain, should it be excruciating pain for me to definitely say I need to go? Or should I wait it out a little while before I do go? What are your thoughts on that?
You know, it's funny. It's hard because, like, you know, even looking at this again, I'm thinking very much ER. Like, all of these things potentially could be something concerning. You know, but you know, that being said, I feel like, you know, you also kind of have to, you know, use your gut. Like, you know your body best. You know your body better than, you know, anyone. And I feel like you can kind of tell when like something is something I've dealt with for years, or is like something feels a little different today. And then I would say, you know, if that's the case, then either, you know, if you can make it to your primary care doctor and they can see you quickly, great. But if it's something you can and you feel like you can't really hold on, then come to the ER and let's just take a look at you. You know,
and that's what I'm doing. I'm just poking the bear because these are the things that we should possibly go to the doctor to, you know, see about. Instead, we'll be like, no, it'll be all right. And then we can't get up, or we can't call somebody to come
Right.
get us, or whatever else is going on where we can't get there. So, like, if it's something of concern, whatever it
Yeah.
is, go on and see that doctor
Exactly.
and see your options because they help you pay for it. Maybe.
Yeah. Exactly. Exactly.
Okay, so we have a question. Dr.
Yeah.
Cindy, she said, how can you spot an underactive thyroid? Are there ways to treat it holistically? Holistically. Yeah.
Gotcha. So how can you spot an underactive thyroid? So let me see if I remember the question. Okay, so for people that have like low thyroid like hormones, that means like their thyroid is not producing like enough hormone. So you can have like a bunch of different symptoms like dry skin, some like constipation, um, and the main things I would say is how you actually diagnose it is number one, again, with your primary care doctor ordering some blood work to test your thyroid levels.
Mhm.
And depending on what that shows, they may recommend you may get like an ultrasound or some type of imaging of your thyroid as well. And then in terms of are there any ways to like treat it holistically? Well, it depends on exactly like what it is because there's like a bunch of different thyroid disorders. So it would kind of depend upon like what it actually is and what the recommended treatment would be. But I think in that case, with anything, I feel like you should always feel free to discuss it, especially if you have an idea of like something that you want to try, then asking your provider and say, hey, I know you're diagnosing with this. Do you think this would make a difference? Like, what evidence have you read about it? Like, what have you heard about it? So I think you can always come with those type of questions.
And what does the thyroid do?
So the thyroid basically produces what we call it's basically produces like thyroid type like hormones, and that affects a bunch of different things throughout your body.
Okay.
So that's basically what the thyroid does. The specialists that deal with that mostly are like an endocrinologist. So
Mhm.
those are the people that deal with like a lot of like hormone type issues,
Mhm.
including like diabetes. So if you ever did have an issue with your thyroid, I think going to an endocrinologist is probably the best place that you're going to get the most information.
Okay. We have another question.
Mhm.
What exactly does an EKG do, and what results do you look for when performing an EKG on a patient?
Good question. This is probably one of the most basic tests that we do in the emergency department. If you come in with chest pain, this is the first thing that you're going to get. And
Okay.
so EKG, for those that may not have heard of it or have never actually experienced this, so it's basically called the term is called an electrocardiogram, right?
Mhm.
And so our heart uses a bunch of like electrical impulses to pump. And basically, with an EKG, is they put these little stickers on your body, and there's a machine. It doesn't hurt or anything like that, but the
Mhm.
machine basically produces a printout of what your heart is actually doing at this time.
Mhm.
And what we're looking for as emergency room physicians, and even any physician, is we are looking for first, is there any type of like damage or any type of injury to your heart? So
Mhm.
that's what we're mainly looking for on the EKG. And then we're also looking for certain signs to suggest that there may be something going on with your heart, or if you have some type of genetic issue that may be going on with your heart,
Mhm.
right? So we get these in people that come in with chest pain. Anyone that passes out at all, we look to make sure they don't have like any type of like abnormal rhythm, that their heart is like doing some type of weird beating, that's
Mhm.
what caused them to pass out. But those are kind of the main reasons that we get an EKG. But usually one of the most basic tests, and usually one of the first tests we get on a lot of people that come in.
Awesome. I can't wait till I watch last week's episode of Grey's Anatomy because I feel like I have just upped my game a little bit.
Oh, did you miss it?
I did, but I hear that
Oh, it was good. It was
Meredith came
good.
out of her coma. I got a question about this
She did.
before I go into the next
Yeah.
question. So when
Yeah.
you're in a coma, can you hear things that's going on?
Yeah, I have heard that. I have heard that like because we deal with like a lot of patients in the ICU that are like on a ventilator. Like we encourage the family members to like sit down with them and talk with them because
Mhm.
at least to my knowledge, I believe that they may be able to hear what you're saying. So
Got it. Okay.
yeah.
Yeah. Watch out, Grey's Anatomy. I'm never going to be watching with a different eye. Another question said, are there heart conditions that come up that is not shown on an EKG?
Yeah, no, absolutely. EKG is really just, one kind of snapshot of like what your heart is doing. And, we can't identify like every single like heart condition,
Mm-hmm.
but, there are a bunch of other tests that can be done. We may end up doing like an ultrasound or what's called the echo of the heart. And that's where we are actually able to look in real time and see how your heart is actually performing. And for a lot of people that are dealing with, chest pain, or they're concerning for like a heart attack, we
Mm-hmm.
may do what's called like a stress test. So maybe you've seen that in the movies, like when people's like on a treadmill and they're like hooked up to a bunch of wires and like they're looking at their heart. That's another test. That's another thing we could do to, see if they have any type of like issues with their heart.
Okay. Oh, they answer a professional now. Can diverticulitis, look at me, be life threatening?
Gotcha. So let me explain what diverticulitis is first.
Thanks.
Diverticulitis, right? So it's a disease that affects your colon, or your like large bowel, and basically it comes from what we call diverticula, and diverticula is basically, there's like this area of weakness in the actual bowel wall, and it forms a kind of a little bit of pouch. Now, quite a few people have it, and as long as it doesn't get infected or anything, then it's fine.
Mhm.
But when it gets infected, that's when it's called diverticulitis.
Mhm.
And basically that's an area of like infection and inflammation, and it really depends upon the severity. I mean, there are some cases where they're very mild and they can just be treated with antibiotics at home. There are
Mhm.
other cases where they have to come to the hospital and we have to treat them with IV antibiotics. And then there are other cases when it can lead to like other complications as well.
Mhm.
And then that's when you're talking about potentially like getting your surgeons and stuff involved. So it really depends upon the severity. So can diverticulitis be life threatening? It can be.
Mhm.
There are definitely cases where it can result in a lot of different complications, but I'd say probably for the most part it can be managed with either oral or IV antibiotics.
Got it. Um, Question: what was maybe your top three best cases so far?
Ooh,
One to three.
oh man, 1 to 3. Let me see. I guess I'll just go by. I'm trying to think of like what each case kind of meant. I'll
Mhm.
probably go with probably the case that like I was, I guess, kind of blown away from, and it was just a good message about how to stay safe, especially in the streets of New York City. Is I had a patient who lost her arm getting it basically taken off by the subway.
I shouldn't ask this question, but you went
And
like 1,000. I thought we was gonna stay in the
yeah,
50s. Go
right.
ahead. Go ahead.
Right. Yeah. Yeah. No. I mean, and the reason that case just sticks by me because that was just like probably one of the more gruesome injuries that I had seen, and for me, it was a message that like to not stay anywhere near the edge of the subway.
Absolutely.
Um, yeah, because
Absolutely.
unfortunately in New York City and I don't know other especially urban areas as well, is that like we run into so many people like pushing people onto the subway tracks. We dealt with a lot of subway injuries, but that was probably one of the more gruesome injuries that I saw. So that always kind of sticks with me. Um, Another
Was her arm
case,
able to
yeah,
be replaced? Like, or
no, no,
okay.
it wasn't. Yeah, it's been gone too long. Yeah.
Okay.
Let's see. Another case that sticks by me just because I thought it was a nice ending was, so I was doing my ICU rotation. There was a guy, I'm not exactly sure what happened or what led him to, but he had jumped off a bridge. Now I'm not sure if someone pushed him or what, but he was in like rough shape, and we didn't really know which way it was going to go. But over time he began to gradually get better, and it was like maybe 6 or 7 months later I was working in the pediatric ER, and like I didn't even recognize, he happened to be walking by, and he was like, "Hey, you were the doctor that like took care of me." And I was just like, who are you? He's like, "Yeah, remember me? Like I was in ICU." And I was like, "Oh my God, you're like walking and stuff." And he's
Yeah.
like, "Yeah, he's like, I got a little hearing issues, but other than that, I'm good."
Got it.
So that always kind of stuck out to me. I always think it's nice to hear, a nice story.
Mm.
Um, and let me think of a third one. Third one. I'm trying to think of maybe if there's like a kid one or like, I'm trying to think even my Hmm. Uh, maybe I'll go with my first like COVID patient. Maybe I'll go with that.
Okay.
which was an elderly lady. I think she was like in her 70s. Um, and for me, because I came back to the ER, so I was actually conveniently enough, I was on vacation when COVID hit, so I didn't have to work
You
in
know
the
what's coming and didn't tell nobody.
yes, I didn't have to work the first like month, which was great. So by the time I came back, we were kind of like we at least had an idea of like how to at least keep ourselves safe and stuff like that. But like
Mhm.
I had so much anxiety like coming into the ED, just not knowing what to expect. And I just remember like this elderly lady who came in. Thankfully, it seemed like she had like a fairly like mild case, but it always just kind of sticks in me as like be seeing actually COVID for like the first
Mhm.
time. It's just
Mhm.
seeing how devastating this disease potentially
Yeah.
could be, and it is. So
Yeah.
yeah, probably those three.
I thank you for that first one really took me out. Whew.
Yeah,
The
took me
last
out too.
two, I'm glad that was the first one. But the
Yeah,
last two, and even sharing that transparency of anxiety that doctors can have too, because you're doing
oh, yeah,
everything you can do, but that doesn't mean that that person is coming in is doing what they can do. We have people that are
right.
spitting on people or different ways that they're doing that's just not. And these are things that possibly very well may have happened prior to COVID of the treatment or of how people, exchange fluids and things of that sort. If they're upset, how they're irate in the hospital and things of that sort. So again, kudos to you as well.
Thank you.
Ooh. One more question we have. She said, "What was one of your most gratifying moments working in a hospital?" You may have shared it, but if you have another one.
Ooh, ooh, that's a good question. One of the most gratifying moments. I would probably say, I mean, there's a bunch, but I would probably say, excuse me, probably we had a young guy. It was geez, I think it was my intern year. We had a young guy. I think he had also like jumped from a building, and he came in and his heart wasn't beating at all. And there's a bunch of different procedures and stuff we had to do at that time. And I think it was gratifying because it was truly a team effort. So it was myself, it was a bunch of my other co-residents at the time, some people from the trauma team, and we actually were able to bring him back, which is not common. It's very much not like TV. Like there are very few times we can bring somebody back once their heart stops. And
Mm,
the fact that we were able to, and able actually to be able to send him to like a rehab facility to like be able to get him moving again, like is nothing short of a miracle. So that moment just represents one of the many I've had where I've been able to work with a lot of different
mm,
physicians and be able to have a positive outcome.
mm. So good. Good to hear. Being able to save lives and make that impact, and being able to see somebody some months and days later saying, "Hey, I remember you," and knowing that
Yeah,
you made the impact is like totally cool because sometimes you may never see these people again, and you're hoping that they
right.
are following the guidance that you've given them to live a successful life. But sometimes we're hard headed and we don't always listen. But
Yeah.
it's good to hear when we do listen. Another question. Crystal said, "Has COVID changed your perception of medicine?"
Um, I guess to a I guess to a certain extent, I guess of just the medical field and just all the people that just go into it. I think it just really just showed how resilient all of us are, right? Because like I've
Mhm,
never felt you know as much camaraderie as I did while I was taking care of all these like COVID patients, because like for a lot of us it's very isolating
mhm,
because I couldn't see my parents. My wife, who was my fiance at the time, didn't see her for a couple of months. So the only human interaction I had was with my coworkers, right?
mhm,
And so it really just showed me that like you know we could all band together and really support each other
mhm,
and come together to be able to help patients in their time of need. And I remember one of my attendings saying that like while this situation is terrible right now, years from now we're going to be able to look back and be able to tell like our children and grandchildren that like we were there during
mhm,
like the pandemic and like fighting
mhm,
on the front lines and like saving people. So I think it just kind of showed me that we're all in this together, and to embrace the journey.
mhm,
I think we all encounter a lot of different challenges and stuff, and even myself through, because I think people don't realize how long it actually takes to train. to become a physician, and so many sacrifices and stuff like that. But I learned so much about, myself, and have had so many, positive relationships with a lot of different people along the way that, I'm just so grateful to be able to, be in the position I am, to be able to do what I do. And, if I can make someone's life or their day a little better, then I'm happy to do it.
Very nice, very nice. It made me think that COVID kind of gave hospitals an unintentional team building exercise because you get together and come together. You find out who everybody really was, like, the habits that people have, but it also helped to bind you together as you work to help those that come in through the door. So again, thank you so much for all of your service and all of your co-workers and those of that sort, because it's very, very appreciated. So what would you say are some things that you want us to walk away with today as it relates to what we've shared, or something that's been on your heart that you feel like the community will benefit from knowing?
Yeah, I would say probably the most important thing is to not be afraid to be an advocate for yourself and to take charge of your own healthcare. Like as we discussed, there's a lot of different things that you can do, for yourself, but there's also things that, in terms of like just your own health, but there's also things you can do in terms of making sure you understand what's going on with your body. So my last message would be, don't feel intimidated, when talking to any type of like healthcare professional. Take the time beforehand, come prepared with all your questions and stuff, and don't leave until your questions are answered.
Very good, very good. And then I could call back if I have another question, though, right?
Oh, absolutely.
Google and WebMD only gonna tell me what's so much.
Right.
I gotta go to my assigned barber, my assigned doctor, to make sure I'm getting what I need. So awesome. This was really, really great. Thank you so much, Dr. Charles. What was that phrase or key phrase for today?
It was embrace the journey.
Yes. And why did you choose that?
So I choose it, again, because like, my journey has just been so long, but yet so rewarding through, everything I've been through. And like, I wouldn't change anything for the world, or even all the challenges and the pitfalls and stuff like that, because it just taught me so much about myself, told me about life, and, just helped me build bonds with a lot of good people, that I'm still really good friends with today. So embrace the journey.
Awesome. Thank you so much. Sherry said WebMD will put you in the hospital. It may, you may go for one thing and find out you got something else going on. So again, if you feel like you need to go, by all means, go to the hospital, let the expert check you out. And if you feel like you hear the violin music playing, we thank you so much for coming in. This is what we ruled out. That you're okay. But again, don't hesitate to go to the doctor. Please, please, please know that your health matters. You can't do stuff for other people if you're not together, if your health is not where it needs to be. And even if something is going on, at least getting the pieces together to manage whatever it is that's going on so that you can be the best version of you. Oh, thank you again so much, Dr. Farmer. This was cool. Yep. You told us our phrase, gave us our closing. Yeah. So again, be sure to follow Dr. Charles. Again, I was stalking a little bit on his page, so definitely want to have him and his wife back. As you heard, he said that they were engaged, but then got married during quarantine. So that's pretty interesting too, because
there's a story behind that.
I'm sure. I'm gonna go back so we can talk about that. We like to talk about relationships here. And giving wisdom and encouragement to others that are trying to explore that. So definitely will connect with you both, figuring out what season, series that'll be, which month, and things of that sort, but I'll be in touch. Thank you again so very, very much, and have a great evening.
All right. Take care. Thank you.
Oh, that was great. We just had Dr. Charles Farmer, Your Health Matters. Did y'all enjoy that, chosen friends? I know I did. So he told us a phrase. Because guess what we got coming up? A day of empowerment. And you know what? It's booked. And I did a nice flyer, so check it out.
Get ready. Chosen Counselors presents a day of empowerment. Join us on Saturday, May 15th from 10 a.m. to 1 p.m. virtually as we will inspire, motivate, empower, and strengthen all attendees. Topics include self-care, parenting, healing, singleness, business, dating, married life, burnout, and more. Special guests include Christian Mills, Todd Davis, Sherry Thompson, Marquise Coates, Tiffany Wilson, Bob Fleming, Sierra Brown, Maurice Williams, and Dr. Ulysses and Shanika Pratt. Planning to attend? Visit eventbrite.com, search Chosen Counselors, and select the link to purchase your tickets today. So join us on Saturday, May 15th for a day of empowerment. Be sure to mark your calendars and tell a friend, as this day of empowerment is brought to you by Chosen Counselors.
It's going to be good. And as shared, I have a ticket to give away. So if you remember what our keyword, our key phrase was, be sure to put in the comments so that you can come. Don't forget our quote of the day. Take care of your body. It's the only place you have to live. By Jim Rohn. Take care of your body, people. Okay, so next week, join us as we will have Dr. Nadira Coles talking about the C word, COVID-19. It's going to be good. So if you do know what the code word is, I'll come back and check it out. I don't see it right now, but if you put it in, I got a ticket for you. Thank you again so much for tuning in. Special thanks to Dr. Farmer. That was great. Share this with somebody that needs to hear some of the nuggets that were shared tonight. Thank you all again so much for your support, for tuning in, watching, sharing, liking, all that good jazz, and even commenting below, helping me to ask some questions to my experts, okay? I love you all for real. Until next time.